So today I've had a few patients coming in last week, and we were talking about partial situations. So I thought it'd be interesting to talk about partials, and that budget's out now. GST going up in October.
It's going to happen.
So I thought, well, let's just offer some 15% discount for CTV viewers now, if you like.
That's very generous.
Well, it gives a bit of encouragement to come out in this wet, cold, miserable day. So
tell me about partials, though. Who uses partials? Who has them?
We've got several situations. If you lose a tooth, one tooth in the front, it can be aesthetically driven, so you don't want to have a gap, so you have one partial, a one-tooth partial. You can also, if you lose several teeth, you want to be able to function, you want to be able to chew your food properly. So there's two reasons why you have a partial. Clinically, we tend to look at having a partial for a space maintainer.
Okay.
So in a situation like this, for instance, I've got a nice little poster that sort of explains it all. So in this patient here, they've lost quite a few back teeth, because the back teeth, or your molars or your premolars, are the ones that do the grinding. So naturally enough, if you've got lots of gaps here, you're losing masticatory function, so you can't chew your food properly. But also for us, as clinicians, teeth are in a dynamic state. They're always moving. So they're looking for something to oppose to grind your food.
Okay.
So you end up, if we jump down to the bottom here, these teeth are able to drift and over-erupt because they're looking for something to grind your food.
So that's why it is not good to leave a gap
for too long. So here, I don't know if the camera's picking it up, this tooth has actually drifted backwards and it's starting to tilt.
Quite badly.
Whereas this one's starting to drift downwards, looking for that opposing antagonist, we call it, tooth. So it is very, very important clinically to have a partial, so it's maintaining the space, maintaining masticatory function. Okay. So there again, in a situation when you've lost a lot of lower teeth and you've just got your little, your anterior teeth, your lower 3 to 3s, we can have an upper denture, and that tends to drop down a wee bit. So always come and see us, and we can give you the options.
Don't leave it.
Don't leave it. Come and see us.
So 15% off for CTV viewers for partial.
Yeah, for dentures, partial dentures up until, let's say, the end of June.
End of June. John, that is so generous. Duchenne, do give them a call on 03 375 4444. You find John at